Hi, my name is Peter from Art of Physio, and in this video I'd like to take you through a movement routine that you can do when you're experiencing acute low back pain. So acute low back pain is something that's very common but very debilitating when you're experiencing it. And oftentimes what your body needs is just a bit of movement. But where to start? There's so many things that you can do, and these exercises are very low intensity and are really focused to just stimulate that blood flow, to stimulate movement, and therefore also stimulate recovery and decrease your pain. And there's several types of exercises that you can do. A lot of people, they are stretching, and even though that feels great when you do it, oftentimes it's a relatively passive thing that you do, and after a couple minutes or half an hour, you're back to where you were. So the exercise we're going to do today are really focused not just on stretching tissue or not on stretching tissue, but more contracting tissue, more contracting muscles, because whenever we contract a muscle, we stimulate that blood flow, and blood flow stimulates recovery and decreases the pain. Also there, whenever we have that super tight contraction, the moment we're slowly contracting a muscle, then after that contraction, it lets go. There has to be a relaxation after a contraction. And that will also help to decrease that tension you feel in those muscles that feel locked up. So the first exercise we're going to do is a breathing exercise. And you might think, why are breathing exercises good for low back pain? There's a couple of reasons for it. One of them is breathing exercises where you use your diaphragm are very effective in stimulating your core muscles actually, and also decreasing the tension in the muscles in your lower back. And the second reason is that being in pain is stressful. So breathing is a great way to manage stress a little bit, and by focusing on long exhales, we can calm down a little bit, which is only going to put our body in a more relaxed state, and in a more relaxed state, that's where you can recover better. So that's some of the rationale of why we start with a breathing exercise. And most exercises that we're going to do today, keep it around 10, 15 reps of each, and you can do multiple rounds if you feel like it. But the breathing thing, you're going to be breathing the rest of your life, all day, every day, so you can't overdo that. And it might actually help you in daily life as well. If you're experiencing some stress or some tightness, or you have a hard time sleeping, doing these breathing exercises can be very helpful in calming down a little bit. But let's get into it. So we're going to start off with laying on the back. And if you want, grab a pillow. I just want you to be comfortable in this position. I'm going to put my hands here, and I'm going to slowly inhale through my nose. So I'm going to inhale through my nose. That's going to push the diaphragm down, and therefore my belly comes up a little bit. I'm going to inhale for about 4 seconds, and then I'm going to take a nice long exhale for about 6 to 8 seconds. Yeah, and I'm just going to keep on doing that, and with every exhale I feel my body relax a little bit more. So if you can be longer than 6 seconds, that's completely fine. So pick your own pace, and everything should feel calming and relaxing. It's not a fight. And the inhalation part is slightly active. We're inhaling, and the exhalation part is just letting go. It's really about relaxing and letting your body drop onto the table. So that's exercise number 1. For the second exercise, we can stay in this position, and what we're going to do is we're going to rock our pelvis back and forth. Yeah, so we're just going to rock back and forth. And maybe, when you're experiencing a lot of back pain, maybe your motion is a little smaller, and that's completely fine. So we just start at a movement or an amplitude that feels comfortable for you. If that's small, I've had it when I had some back pain. it was like a small motion, but even a small motion will already help. As you do more reps, you will start to feel that you will have a little bit less pain. Yeah, and it's not about squeezing, so I want to keep my upper body nice and relaxed, and everything that I'm doing is just tilting that pelvis. If you feel like, oh, this is actually going pretty well, we can add a bit of a butt lift in that phase. So we're going to round, so tilt the pelvis backwards, and now from here I'm going to drive my heels through the floor and just lift up my bum a little bit. Yeah, then bring it back down, rock the other way, and come back up. Yeah, and I don't care how high you get, it's really just about stimulating that motion. Then again, this is not about performance, right? This is just about decreasing the pain and getting back to just your daily life activities. So performance is not a focus now. And what I want you to do is just feel, go like, hey, if I lift it up a little higher, does that make it feel better? Yes, all right, do it. If you go like, nah, then you just keep it at that height. Yeah, also, think about 10 reps, 15 reps, whatever feels great. You can do multiple rounds of these. So while we are here, we're going to go into the third exercise. And that third exercise is a rotation exercise. So I'm just going to allow my legs to go to the side, and I'm going to feel, I'm not going to drop them, but I'm just going to slightly guide them until I feel some tension in my lower back, and then come back to the middle and do that towards the other side. It's really just about relaxing and moving. And I also here, it's not about performance. I don't care if you touch the floor or not. It's really about just moving. And as you go, move it a little bit more. There we go. Yeah, I want my shoulders to stay on the table, so I'm not rotating with my shoulders. It stays nice and flat. If you do this a couple of times, you might also start to feel that the muscles you're working are actually your obliques. So they are working there and there in that diagonal motion. And those are the muscles that we're using with these exercises. It's not a training for these muscles, it's not focused on performance. It's just about moving and feeling, what is my body doing. Yeah, so once you've done these 3 exercises, it should already feel a little easier to get up. But then if we get up, we're going to go to that next exercise. And so we had that one, so we had rounding and extending. We had the rotation, now we also have side bending. So instead of side bending like that, what I want you to do is lift up one bum. Lift up a bum, lift up a bum. And if you place your hands here on the sides, so my thumb is on the back side, I should feel the muscles contract as I move my bum up. Yeah, if you feel this is super easy, what you can do is just press that in a little bit. And I'm just pushing it down so it's a little harder to lift up. I can also press that down here. Here. And what I want to feel is I want to feel those muscles contract here nice and slowly. It's not about reps, it's not about performance, it's really about feeling, can I just contract those muscles and relax everything a little bit. Yeah, so once you've done 10 to 15 reps each side, you can go to the next one. So we've done spine now. But the hips are also oftentimes involved in issues to the lower back. Yeah? So the next exercise is for that. So we're going to lay on the side, and the motion that we're making is a diagonal. So I'm using my top leg, so diagonal from knee to the floor or knee to the bench, and then I'm going to extend my hip, extend my knee backwards while I keep my foot parallel to the floor. Forward, tap, So some things to consider there is sometimes if you start feeling this in your lower back, you might be actually arching your lower back, and that's not what we want. So what you can do then is just put your hand here on your iliac crest, so that's the big bone that's there, and you're going to hold that. So the moment that starts pushing into your hands, that's where you stop, because that means that's where your hip stops and your lower back wants to help. There we go. And we're going to make about 10 reps of this or 15 reps. And you can play a little bit with the diagonal. Like I can have the diagonal a little lower, go a little bit further back. I can go a little bit higher. There we go. And you're going to feel that each position or each line just feels slightly different. And I don't really care which one you're picking, but I want you to feel the muscles work here, in that bone. There we go. That's it. Once you've done a couple of those reps, of course you're going to do them on the other side as well. So these are nice exercises that you can do to manage your symptoms when it comes to acute low back pain. Yet the exercises should make you feel better. If they don't, give someone a call or give a professional a call and have it assessed. But this should already help with decreasing that pain and tension. Yeah, so good luck with these, and let me know if you have any questions.